Good day, global citizens. Welcome to Dr. Fajembola'S Opinion. This is a platform where research meets understanding and legacy. Today, we are going to discuss malnutrition. Malnutrition is a common topic, especially in this generation where people can't differentiate people can't differentiate losing weight intentionally and losing weight because they are not taking enough nutrition into their body. So today I bring you a colleague who has written a piece on malnutrition. And when I read our publication on malnutrition, I was like, this is excellent to bring on board to educate our audience on other aspects of malnutrition people don't know about. Actually, when people come across malnutrition, they are usually like it's under malnutrition because that's what is common. Like people not taking enough nutrition into their body, people not taking enough nutrients into their body. But malnutrition is a continuum. What I mean a continuum, malnutrition has different segments. It's either you are under mal or you are undernourished, that's undernourished, or you are overly nourished, or you are not taking enough minerals and vitamins into your body, even if you are taking enough food. So there is the overnutrition, undernutrition, and imbalanced nutrition. So I can't wait for you to see and learn what we have for you today. So please join me to welcome our guest today, colleague. Join me to welcome Miss Martha Nwanua Olumide. She's popularly known as Miss Martha Nwanua. Did I pronounce your name right?
Yes, you did. I mean, almost perfect.
Okay, thank you so much. Which title are you comfortable with? Which title are you comfortable with, ma'am?
Mrs. Martha.
Mrs. Martha. Okay, thank you so much. Um, let's dive into the discussion. Let's give our viewers an overview of Mrs. Martha's profile. She is a Nigerian biochemical scientist and global health advocate known for her work in clinical diagnostics, quality assurance in low and middle income countries, and writing on health and gender issues, particularly focusing on nutrition and women's health. She is a research and advocacy fellow with Women in Global Health Nigeria. As the HCPC-registered Biochemical Scientist and the ASCPi candidate, she brings a unique blend of scientific expertise and a deep commitment to improving health outcomes in low and middle income countries. Her interest spans across nutrition, maternal and child health, gender equity, infectious disease epidemiology, climate and health, and integration of bioinformatics and AI in public health solutions. Mrs. Martha has contributed to diverse health projects involving HIV, TB, and COVID-19, providing support in project implementation, data analysis, and stakeholder engagement. She is experienced in supporting cross-functional teams, fostering strategic partnerships with NGOs, academic institutions, and global health organizations, and translating data into actionable insight for sustainable development and impact. With a passion for science, collaboration, and equity, Mrs. Martha aims to drive innovation at the intersection of laboratory science, public health, and climate resilience. Beautiful profile, Mrs. Martha. I gave an overview at the beginning of malnutrition and what people usually know malnutrition to be, as people usually tell malnutrition to be only under malnutrition. Mrs. Martha, what is malnutrition? What should our audience know about malnutrition?
Thank you so much for the beautiful work you do. I mean, bringing our work into limelight for the public and for those who cannot easily read. papers and listening to them. Thank you so much. So diving into our topic for today, malnutrition, I'll just define malnutrition as an imbalance between the nutrient our body needs to function and the nutrients our body actually gets. Now, simply put in a layman terms, that malnutrition happens when our body doesn't get the right nutrients or the right amount of nutrients, or there's just a wrong imbalance. Like you earlier said, malnutrition actually exhibits in three forms. We have the undernutrition, where the body is lacking the proper nutrient needed for growth. And then in undernutrition, you can see things like stunting, you can see things like wasting. Now, stunting in the terms of a chronic lack of growth, and in the layman's term, that's you're too short for your age. Then there is wasting as well. Wasting, when we're talking about wasting, we're looking at acute weight loss. In the layman's terms, you're too thin for your height. And then you also see underweight. And then we also have micronutrient deficiency. This is where your body is not getting enough food, or enough food that contains nutrients needed for your growth. Now, the difference between those micronutrients and undernutrition, in this place, you're actually lacking the essential vitamins, minerals that are needed in small quantities for your body to actually grow and develop. And then there's also the last form of malnutrition, which is the overnutrition. Now, overnutrition is a form of malnutrition. And what happens in this place is that you consume excess food that contains high calories, and thereby leading to like unhealthy accumulation of fats in your system and leading to obesity. So in this place, you are taking too much of unhealthy nutrients, which are the high calories, thereby it's causing things like obesity. And then when you look at it on the long-term effect, is leading to diabetes, heart disease. So that's basically what this is about for malnutrition.
Thank you so much for giving us that beautiful introduction, Mrs. Martha. And I'm glad our audience are eating good in quotes. So, Mrs. Martha, what are the factors? What factors are contributing to Nigeria's nutrition emergency? Actually, it's when I read your publication, I realized Nigeria is facing a nutrition emergency. I didn't know about it. So, what factors contribute to Nigeria's nutrition emergency?
So, like you rightly said, Nigeria is actually facing like a nutrition emergency. A research released by the International Federation of Red Cross in August actually stated it, showing the urgency to this. Before I talk about the factor, I think we should also look at the fact that in Nigeria, 45% of children's deaths is actually caused by this malnutrition. That's how urgent this is. It's really like an emergency situation. Now, there are various factors that contribute to this malnutrition. It's not just one. It's actually like a complex mess of things. So the first factor we'll be looking at will be looking at insecurities. Insecurities. Now we can see that there's an high rate of insurgencies and insecurities in the Northeast, Northwest. Now this causes displacement of people from their homes, destroying farmlands. Now people can't actually plant, and you end up seeing them not eating nutritious food. Then we also see things like severe economic hardship, poverty, currency devaluation, inflation, making food very unaffordable, where family have to go to bed without eating, or they would have to look for a substitute for something with less quality, diet quality. We can see things like climate shock, floodings in some areas, also destroys farmlands, leading to no production of food. We have things like our weak healthcare. Now, our healthcares are underfunded, and then you see it's already becoming overwhelming. So they can't actually give us, there's lack of access to care. And then you see this is actually leading to limited resources and therapeutic tools for nutrients. Then other causes are government policies, food system failures, where you see there's now a high shift to that's processed food, fast food. You see things like that. And then there's also poor sanitation and hygiene. Poor people have inadequate knowledge of breastfeeding. All these are factors that contribute to malnutrition and the national health crisis.
Thank you so much for explaining that for explaining that in details. And I believe our audience are following on from the definition to the factors contributing to the nutrition emergency in Nigeria. Um, Diving more into the discussion, in the paper you talked about gender food crisis, gendered food rules and gendered nutrition. Please, can you shed more light on the gender food crisis and the gendered food rules in Nigeria?
Thank you so much. So before I dive into that, I think we should start from the basic, the definition. Now, what is a gendered nutrition gap? So when we're talking about a gendered nutrition gap, we're looking at ways in which the women or girls' unique biological needs, disparities in access to food, nutrients, social norms actually have a burden on their health outcome. Now, we have lots of gendered rules looking at starting from our homes. We have the intra-household sharing where men take the choicest meals. And you see in most homes, the men would love the breast. And we know that the breast of the it's I think when we're looking at the most nutritious part of like a chicken, let me use a chicken for instance, we're looking at the breast, we're looking at the gizzard. Now the breast actually has a very low calorie and high protein. And this helps in the building of muscles and development for men. And you see them dragging it, but forgetting the fact that this part also has a lot of benefits to the women. So there we see intra-household sharing. We also look at certain taboos and norms. You see things where when ladies are pregnant, you hear people say, do not eat too much so your baby would not be big, scaring the lady from actually eating the amount of food. Then you see taboos like, oh, the gizzard, especially in the eastern part of Nigeria, you get people say the gizzards are for men. Now, the gizzard is like the powerhouse of the chicken. This gizzard is rich in things like iron, folate, B12. So imagine taking those part of it, of the chicken away from the women, and giving it to the men. That's why I think from a research, we've seen that 55% of women in reproductive age are actually anemic. That's what happens when you see men dragging this part of food. So these are part of like the gendered rules that contribute to malnutrition. And aside that, we've also seen that when these gendered rules show up, they actually limit women from accessing things like lands, loans, and all these lands and loans. It actually prevents them from growing the nutritious foods they need. Loans prevents them from getting the money needed to invest in healthy meals or even get side meals that are actually very. So all these things actually causes nutrition crisis. When all these gender rules are there, you tend to see that the consequence at the end is high rate of malnutrition, where you have lots of undernourished ladies, you have overweight ladies, and this affects their immunity, this affects their concentration, also affects them in pregnancies. You also see the instances of economic hardship. Now, from a research, it shows that in Nigeria, we lose $56 billion annually due to low productivity. And this is also as a result of this gender crisis caused by these gendered rules. And then there's something called the intergenerational pattern or intergenerational impact. You see that a malnourished woman would end up giving birth to a child who is also malnourished, who is stunted. So all these gendered rules actually create a very significant nutrition crisis, especially for the women. Thank you.
Thank you so much for elaborating on that extensively, Mrs. Martha. Actually, the myth about only men should eat the gizzard is only to Nigeria. I schooled in Uganda, and I don't know if it's the whole of Uganda or specifically the eastern part of Uganda. They give their men the gizzard. I even had colleagues. I had colleagues who, when they cook their chicken, they'll give the gizzard to their male colleagues because the gizzard are for the men. And you can imagine the culture, how we've integrated or prioritized some parts of our culture which are negatively affecting us, which have affected the previous generation, our generation, and if we don't stop it will affect future generations of global citizens. Thanks so much for highlighting that. And we often think that, oh, malnutrition is just about food and if we are not eating, we are saving food, or we are, I don't know, we are keeping fit in other areas. But to find out that, as you highlighted, about $50 million or above that, which you mentioned, is lost annually due to low productivity from gendered roles, from malnutrition, um, highlighted by gendered food rules we have. And thanks so much for discussing that extensively. Gendered food rules is when I read the paper. This is why this platform is important. When I read the paper, I saw it from the outlook of just Nigeria. But from your explanation, your perspective, I understand that, okay, this is what is happening in other countries across the globe, where men are prioritized and given the best meal in the house, and when the children are deprioritized and given the worst food at home because they are still young. So the food is given to how old, according to your age at home. So thank you so much for that. So now talking about food, shifting from gender food roles now to other foods. How does fast food, because fast food is common, I'm also one of those people guilty. How does fast food contribute to malnutrition?
Thank you. So one thing about fast food is that the fast food are actually very high in calories, in salt, unhealthy fats, sugars, and then they are low in fibers, minerals, folates. So what happens is fast food contributes to malnutrition by providing your body with excessive unhealthy fats, sugars, thereby leading to accumulation of these fats in your body, leading to obesity. That is overweight. Obesity is a form of overweight, that's overnutrition. And then while you're lacking the essential vitamins. So what is happening is you're going to be looking overfed. Meanwhile, you are still undernourished. That's just what happens. So it's creating like a double burden of malnutrition. In a layman's terms, let me put it as this: a lady would be looking well fed, she's looking overweight, gaining weight, but behind the scene, she's actually very anemic and undernourished. So that's what happens with fast food. So fast food actually is giving the vibe of you being overnourished. Meanwhile, at the end, you are lacking the essential nutrients, because that's what it does. It's high in calories, it's high in fat, is high in sugar, and it's low in the essential nutrients that are actually needed for the body.
Thank you so much for that. Fast food, majority of people now, majority of the world now, we are fast food consumers because maybe we are too busy to cook, or we are actually because of time, because of how we are saving time. But we are not saying we shouldn't eat fast food. If we should eat fast food, it should be minimal. We should consume more of healthy food, well-cooked home meals, because health is wealth. So that takes us to the next question. Diving into the paper. Now I'm getting quotes from the paper. What's quoted in the paper? Where you said a double burden of malnutrition. A double burden of malnutrition. What is this, Mrs. Martha?
So a double burden of malnutrition simply means undernutrition and overnutrition coexisting in the same community, in the same person, in the same household. So you're having undernutrition at the same time having overnutrition. That's just basically the double burden. In fact, I think from recent study I was making, what right now what is happening is no longer the double burden of malnutrition. It's actually a triple burden of malnutrition, because while you're being undernourished, you're as well lacking essential vitamins, which is a micronutrient deficiency. So this is actually a triple burden. So you are being undernourished, you're being overnourished, and as well having a micronutrient deficiency. So that's like a triple burden.
Okay, thank you so much. Before we dive into other questions, let's look at what global citizens are saying about malnutrition. The first is from Nwanua Olumide, where she said, "Today we successfully planted 9,000 trees in the southern province. It was a special community service led by RW Equity Bank. This is aimed at, I guess, RW is Rwanda. Equity Bank. This is aimed at environmental conservation, combating malnutrition, all in support of achieving national development goals. We go green Rwanda. I feel it's important to mention that it's not only the job of the government, although they have majority of the job, they are the one with the funds, the majority of the job in terms of malnutrition, but we need relevant stakeholders to come on board. That includes you and I to combat malnutrition. And that tweet is from Jack Darwin, where he said the majority of students in China pay for school lunches, and it's common for schools to run out of funds to provide nutritional free meals, especially in poor and rural areas. It's improving from the Cold War era, but malnutrition is still a major issue in school canteens. It's surprising that even a first world country like China is still facing malnutrition, especially in children. Last is from Abdallah, where he said, why should you prioritize art over the lives of your subjects? 1 million out of school children, many of them lack food and are facing malnutrition and all that. Though these are your priority, these people can go international. You account for your office on the day of Kiyama. And this person is reacting to, I guess, a tweet on sponsoring Muslims going for Hajj instead of catering for the citizens, giving them enough food, especially in Nigeria now with the current political climate in the country. So those are the tweets I wanted us to look at. So going back to the discussion, Mrs. Martha, in your publication, you talked about the SIGA gender and food systems framework. What should we as global citizens know about the SIGA food, gender and food framework?
So the SIGA gender and food framework basically is talking about the fact that our food system is gendered right from the farmland down to the fork. Simply put, what it's doing is it's looking at how gender inequities show up in who produces food, who controls the resources, who benefits from these resources, and who decides who benefits from these resources. Now, 3 key highlights or messages from the SIGA. We look at the resources in terms of land, credits. Now, one thing is in Nigeria, even though 70% of the women are actually the ones who produce this food, just 1% actually own land. We have less than 23% of women who can actually have access to credits. And now, without this land ownership, without this credit, access to credits, they cannot invest in irrigation. They can't even invest in their farmland. So there is lower produce in the food that comes out of this farmland. Another thing also under this SIGA is the agency. That's the deciding power. One thing we need to say is that women are actually missing in spaces where decisions in agriculture, health, nutrition, decisions are being made and budgets are being made. I know that the national gender policy of 2021 to 2026 actually said women are now involved. But one thing that I can still see lacking is the implementation. Women are involved, but are these things being implemented? So the implementation is actually very weak. So the last thing we can actually talk about are the structures and norms. I think a lot of education needs to go into the structures and norms. So basically, this framework, what it does is that it actually helps the government and partners to actually check their blind spots. It helps them look into like the policy, look into food and nutrition. Are they gender blind? Are they gender aware? Or are they gender transformative, as they're saying? In Nigeria, this framework has actually shed light into the land and credit aspect and has shown that there's a big gap between women ownership of land, between women deciding who gets what, that's the deciding power of the meal and who benefits. And we are seeing that this is actually showing up in the health of these women, in their blood work, even as well as on the plates, what these women eat. So that's basically what this gender food framework, single gender food system is all about.
Thank you so much for that. I feel it's everywhere. Like when it comes to the work, we are the ones there, but when it comes to output benefits, we are the least on the scale. It's also in the area of the majority of healthcare workers are women.
Yeah.
70% of healthcare workers are women, but when it comes to research, we are less than 30. The last time I checked, or less than 35 currently. 25% of researchers globally are women. So I believe this is why we have women organizations like the Women in Global Health and other women organizations to ensure women are getting what they need from individual level to national level, and they are well represented in every space. So at the beginning of your discussion, you talked about you highlighted some points regarding effects of malnutrition on women and children, and these are actually the vulnerable population. When you're talking about vulnerable population, women, children, what are the complications of malnutrition on the health of women? Because you can say till tomorrow, oh, women should eat gizzard, women should eat the good part of food, children should eat the good part of food, but they'll be like, oh, after all, they are fine, the women are fine, so why should they change the culture? The women they are giving birth to children, are breastfeeding, and their children are fine, so why should the culture change? What are the complications of malnutrition on the health of women?
So when talking about the complication, I would just divide it or split it into two: the short-term complication or the short-term effects and the long-term effects. First, for the short term, I'll go to anemia. Like I said, from research, 55% of women in their reproductive age are actually anemic. And fewer men are actually anemic. So I mean the percentage. And then when we talk about anemia, we can see other things. It can cause things as tiredness, poor concentration. We can see these ladies who also become women and children become very prone to infection. We also look at things like reduced productivity at work. Then when we also talk about during pregnancy and in childbirth, we can see things like complications in labor, hemorrhage. We also talk about low birth weights and stunted children. Now, according to research in Nigeria, most of the stunting or stunted children, the effects becomes visible as from even before birth and even as early as 6 months. So that tells you that that's a lot is happening there. Now, when we talk about the long-term effects, we're looking at chronic undernutrition happening there. And then we also see things like that's overnutrition, where we see things like diabetes. There's an hike or spike in diabetes, type 2 diabetes, heart diseases. So we have a lot. I can't even exhaust the list. There are a lot. These are just a few I would mention.
Thank you so much. Aside malnutrition affecting the health of women directly, it affects them indirectly in how fertile they are. Fertility affects their fertility rate. It affects the children in terms of if they are pregnant, having malformed children. It affects the whole pregnancy journey, and I feel it's a miracle. Pregnancy itself is a miracle. Then a woman malnourished, being pregnant and gives birth to a healthy baby itself is another miracle. So a woman from when she is born, a girl from when she's born should have adequate nutrition, and which also helps the other systems in the body, from brain to how she thinks and executes, to even the monthly cycle, how she bleeds, how our cells are, what are they calling it, are revived, how she protects herself from anemia and the rest of it. Women are susceptible to more infections and other things. You have issues of urinary tract infections and other things. Having the right nutrition helps your body fight against these infections and reduce your susceptibility to infections, be it through the orifices through your body. When I say orifices, yeah, I guess these are the orifices in your body: the ears, the nose, the mouth, and also the vagina and anal canal. So I not just children, I feel as a population, women as a gender, we should take our nutrition serious. I know we don't like to look overweight. I know we like to keep fit. There's a difference between keeping fit and being um malnourished, being undernourished. Let's make sure we're getting the right nourishment and we are doing the right things we should do to promote our health. There are myths and facts surrounding malnutrition, not just in Nigeria, globally. And with the current keep fit, I keep talking about keep fit because they are the ones that usually sell different teas to keep fit and the rest of it. What are 3 facts and myths around malnutrition?
So, for me, my number one fact about malnutrition is that malnutrition means not just eating enough food. That's wrong. Malnutrition can also come from not eating the right type of food, because you can eat food every day, but if you're eating more of fast food, you will just be looking nourished, but meanwhile, you actually lack the essential vitamins. That's what we call eating hunger comes from. The second myth I'll talk about is that only children are affected by this malnutrition. That's wrong. So children visibly suffer from malnutrition, but the thing is, women and adults silently or quietly, non-visibly, actually still suffer from those malnutrition. So we actually have 55% of women who are in their reproductive age that are anemic, but you probably wouldn't see it. We also have, from according to research, 7.3 million adults, women, and teenagers are also malnourished. So it's not only about the children. And the third myth is when you focus on women health or women nutrition, you're leaving the men and the boys aside. That's not true. When you invest in women nutrition, you're literally investing in the whole household. I know they usually say train a male child. I can't remember how that saying goes, but it's just like that. When you actually invest, you're actually taking everyone along. So according to a research that was carried out in the southern west part of Nigeria, it shows that after a training around nutrition, that the intake of vegetable among household increased by 18%. And then there was another research that showed that when women were given the power to also decide what should be eating, that the household quality of diet actually improved by 15%. And then there was a drop by 6% in stunting amongst children. So these are my 3 myths and facts. Yeah.
Thank you so much. There are so many myths about malnutrition. I guess the common one is when they say someone is malnourished, they will say, "Oh, they are not eating enough, they're not taking enough." And as you explained at the beginning of our discussion, that it's not just about you taking lower than what you should take nutritionally. You might also be taking over. You are also malnourished. This paper focuses on malnutrition in Nigeria. Mrs. Martha, what are 3 things we should know about malnutrition in Nigeria?
So 3 things we should know about malnutrition in Nigeria. Number 1, it is big and it's getting worse. So we have 4 in 10 children who are stunted in Nigeria. Out of 10 children, 4 children are stunted. That's really bad. And then over 2 million children are facing severe malnutrition. Number 2 is that it is deeply gendered. 7.3 women are actually malnourished. 15 at the age of 15 to that's 10 to 15, we have about 55% of women or teenagers who are anemic compared to the percentage of that in men or in boys. The third one is that it is extremely expensive but it's solvable. Extremely expensive in the sense that our economy is draining because we're trying to save people when we should invest in the right way. Like I said earlier on, research has shown that $53 million is actually lost as a result of low productivity due to malnutrition. That's 12% of Nigeria GDP. I mean, that's a lot. This money could actually go into other things if we're investing so much in our health system and investing in the right things. But looking at it, 12% of our GDP getting lost due to malnutrition. So it's actually very expensive, but we should also understand that it is solvable.
We've discussed malnutrition now for a while, and our audience can be like, oh, I'm eating, I'm fine, I'm not falling sick. I don't think malnutrition is a big problem, even though they say it's a big problem. People can lose weight if they want to lose weight. People can intentionally refuse to eat well if they don't want to eat well. As long as as long as my nutrition is perfect, I don't care about other people. So what do we stand to gain as global citizens? What do we stand to gain from a well-nourished generation of citizens? What do we stand to gain as a nation?
So a well-nourished generation is like upgrading the engine of Nigeria. Now, for the children, when a child is well-nourished, you see better concentration at school. These children end up growing up to be adults who are very productive and improving the environment or the nation. For women, you see there are fewer loss of pregnancies as a result of complications which could arise from being malnourished. You see women actually, you see the diet of the family also improving. So when we talk about being well nourished, you're not just only talking about looking good or keeping fit. You're looking way beyond that. Even as a nation, we see that we no longer lose so much money into lack of productivity because a well-nourished individual stands to be more productive in the environment. So you see better concentration, lesser expenses in terms of trying to take care of yourself or buying drugs because you're well nourished. Yeah.
Thank you so much for that. Reading from your publication, I got more understanding of the depth of malnutrition in Nigeria. And I feel when every citizen is well nourished, you have an exponential increase in the gross domestic product of the nation. When every citizen in the nation, when they are well nourished, productivity increases and you have an exponential emphasis on exponential increase on the gross domestic product of the nation. Why? Because when you're well nourished, you have lesser chances of falling ill, you have lesser you have longer lifespan, you have much productivity at work, more output, you have better community cohesion, you have better intergenerational cohesion, you have greater resilience as a nation. So being malnourished has a positive effect on every sector in the economy. And this is a call to relevant stakeholders, the government, and other stakeholders who are working on nutrition of global citizens at local, regional, and international levels. Please put more effort in what you're doing. Thank you for what you're doing. Put more effort in what you're doing. And we hope the other strides from other sectors across the country is improved from proper nutrition of citizens. So we are closing the discussion, and the last question I have from this matter is, where do you see Nigeria and the management of malnutrition in the next decade? In the next decade, as a nation, where do you see us on the management of malnutrition?
Thank you. Okay. If I would be sincere, if we do nothing by, when I mean by nothing, meaning if we continue with tiny budgets, weak implementation, gender blind policies, what will happen is that stunting and anemia will actually be stubbornly high. It would increase. And then you would see women battling with obesity, battling with diabetes in addition to the eating hunger that we already have. But if we do something by investing in better nutrition, improving our policies, school feeding, fortification, we would see things like you'll see improvements, and you'll see things by like cutting down stunting by maybe 20%. We'd see things like having anemia and undernutrition lowered. And then we'll see things like reduced obesity. So I feel like we're just sitting on a double-edged sword. If we do nothing, this is what will happen. We're going to have a spike in anemia. We're going to have a spike in obesity. And then if we do something, you'd see an improvement in these: cutting stunting, reduction in anemia and undernutrition, reduction in diabetes.
Thank you so much for that, Mrs. Martha. Thank you so much for sharing your time and expertise with us. We had a very beautiful discussion, and when you talk about the management of malnutrition in the next decade, I actually don't have any answer for the first time, because Nigeria is growing a lot in terms of technology, westernization, and a lot is changing in terms of our good food culture. So you can't say, for me personally, I can't say in the next 10 years, Nigeria as a country will reduce fast foods, or will eat more, will have better nutrition in terms of home cooked meals. So I would, before even asking you the question, what was on my mind was, oh, we'll be on the fence. We'll be on the fence. Or the way our societies progress will decide what path will fall into. But with your answer, let's be optimistic. Let's be optimistic about Nigeria, that in the next 10 years we'll have better nutrition. There'll be more involvement of different stakeholders in combating malnutrition at every level. So, global citizens, this is a platform where research meets understanding. We looked at Mrs. Martha Olumide's paper during the week. Please go to it, read it. It's a beautiful publication. It gives another perspective on malnutrition in Nigeria beyond what is normally discussed daily. So have a blessed week, everyone, and don't forget to share with your neighbor. Don't just add this knowledge, share with your neighbor, share with people you care about, your family, friends, share people you care about, and let's have a healthier world for everyone. Thank you.